My goal is always to get these kids in within 24 hours from the time of their injury. We'll have them come in, fill out the paperwork about their injury, concussion, and kind of go through their symptoms, and then we'll do an exam, which is pretty thorough regarding their balance, their range of motion of their neck, as well as looking at their cranial nerves, any dysfunction that we can find. A lot of times it's more the just looking at the athlete and you can see the concussion almost in their eyes. A lot of times there's not a whole lot else on exam that we can find, and that's good. Usually if you see something more focally, a focal neurologic defect, that's where we're getting a little more concerned. Some of these kids will recover really quickly. Other ones can take weeks and months to fully resolve. Most importantly, once again, is the physical exam and just talking to the patient. In terms of scans, it's rare that you need to do any scans, especially a CT scan. Those are more reserved for if somebody had a prolonged consciousness, or they're having worsening symptoms, or they have a focal neurologic defect. As long as they don't have those, we rarely don't do any imaging, because there's not much you're going to see. A concussion is an injury, microscopic injury to the brain. It's not something that you can see on a normal imaging study. When you're doing a CT scan, you're looking more to see if there's a bleed, which is complicating the picture. The only test that we do run is there is the impact test, which is one of the cognitive testing tools that are out there to help determine, for me, more return to play. It's not a tool that helps to necessarily, I don't use it to diagnose a concussion. It helps me to really determine if the brain has recovered and are they ready to get back to to their sporting level. So it's really an adjunct rather than the tool. Usually if it's going on 2 weeks, we don't recommend going to PT in those first 2 weeks. We just try to get them better, because the majority of people will improve in that amount of time. If they're still having symptoms after a couple of weeks, then we'll discuss maybe getting into some rehab to see if we can hasten their recovery. That being said, when we work with professional athletes, a lot of times they are trying to get right in, they need to get back, so we are getting them into rehab, sometimes right away, to try to hasten their recovery as well.